Nutrition is a highly underrated lifestyle factor which can markedly improve some mental health disorders. Nutrition impacts your mental health for better and for worse. We are swamped with so many claims about the latest and greatest diets that it is hard to know what to believe. Science, however, has confirmed the positive effects of healthy nutrition on mental health beyond any doubt. The Nutrition Journal published a paper showing that prevalence of mental health disorders has significantly increased in developed countries in correlation with the Western diet. Nutritional deficiencies were shown to correlate with incidence of mental health problems. The most common nutritional deficiencies found in the Western diet are iron, iodine, vitamin D, vitamin B12, calcium, vitamin A, magnesium. B-complex vitamins, omega-3 fatty acids, minerals, and amino acids that are the building blocks of the brain's neurotransmitters that directly impact mental health. The same paper reported that high consumption of food and seafood was associated with a lower incidence of mental health disorders due to omega-3s. According to the study, nutrition plays a significant role in depression, linked to deficiencies in omega-3, B-complex vitamins, and magnesium. Bipolar. Up to 80% of bipolar people are deficient in some B vitamin, and most American patients have low levels of omega-3, taurine, and vitamin C deficiencies have also been linked to the condition. Schizophrenia. Studies have shown the disorder to correlate with increased consumption of sugar. Better prognosis for schizophrenic patients is observed when living in countries or areas where high levels of omega-3 fatty acids are consumed. Let's look at another mental illness, obsessive compulsive disorder, or OCD. Studies found that supplements containing St. John's wort worked better than the SSRI drugs to reduce recurring thoughts and compulsions. Proper medical diagnosis and a clear understanding of treatment options should always be the first plan of action when treating mental disorders. Altering one's diet and/or supplementation can be an important part of a treatment plan. New, well-designed clinical studies are being published daily on the positive effects of nutritional and supplement therapies on all types of mental conditions. So, what nutrients does your brain need? The Mediterranean diet works best when adopted as a way of life long-term. It is proven to have positive effects on depressive patients. Studies show, according to Dr. Sarah McKay in the Mediterranean diet, the best diet for your healthy aging brain, the Mediterranean diet plan consists of extra virgin olive oil as the main source of dietary fat, lots of fruits, nuts, vegetables, and pulses, a lot of fish and seafood, some dairy products, and red meat. Also, we can include in all this a moderate now, intake of red wine. How food affects your emotions. Even though it's a well-known fact that food plays a role in our overall health, the connection between nutrition and mood and mental health has not been very clear. Science is confirming that what you put in your mouth directly affects what goes on in your head, largely because of the neurotransmitter serotonin. Serotonin is a neurotransmitter that regulates appetite, sleep, inhibits pain, and mediates mood. Up to 95% of serotonin is produced in a person's gastrointestinal or GI tract. Your GI tract is lined with millions of neurons that act like a brain of sorts. Now, that I told you some foods to include, let's look at some foods to avoid. Science has shown that mental disorders can be helped greatly by lifestyle habits. A healthy lifestyle characterized by regular physical activity and well-balanced diet can support management of symptoms associated with mental health disorders. Some foods support your mental health, while others deteriorate it. These foods are generally recommended to avoid in excess if you have mental health issues. The first one is excessive caffeine. While studies show that caffeine can improve depression and increase some cognitive skills, too much caffeine contributes to anxiety and psychotic/manic mental health disorders. Alcohol. Alcohol can worsen underlying mental health conditions, whether diagnosed or not. Sugar. High sugar intake is linked to low brain-derived neurotropic factor, or BDNF. Low BDNF levels have been shown to correlate with depression and dementia, and may be a critical factor in Alzheimer's. Salt, excessive salt. Your cells need salt to function properly, but too much has been linked to cognitive decline. Trans fat. Trans fat has been linked to depression and heart disease. And you know, I noticed that when you go to buy your food, any food, look at the ingredients that they say they have in it. Because anything that has a whole lot of trans fat in it is going to contribute to your depression. All right, fast foods. Fast food is full of unhealthy ingredients referred to that I just spoke on, like trans fat, salt, and sugar. Also, the food fills you up, but lacks the essential nutrients your body and brain need. So while you're feeding your stomach, you're not necessarily feeding your cells, the cells in your body. Foods to eat to improve mental health are contained in a Harvard article called Nutritional Psychiatry, Your Brain on Food. Explains it like this. Multiple studies have found a correlation between a diet high in refined sugars and impaired brain function, and even a worsening of symptoms of mood disorders such as depression. Foods that support mental health are going to be abundant in the nutrients your brain needs for optimal operation. Foods that help your brain are salmon and other fatty fish, whole grains, leafy greens, yogurt with active cultures, dark chocolate, seeds and nuts, and berries. So I hope that helps you, give you a little more understanding of how you can take care of yourself and what to do, so that you can operate at your optimum level of efficiency. Thank you very much, ladies and gentlemen.